Kia ora koutou, everyone. Welcome today. Thank you for taking some time with us this afternoon. And hopefully, our goal is to answer any questions you've got around the All of Population Suicide Prevention Community Fund. My name's Kylie Ryan. I am the project lead for this fund for the Mental Health Foundation. And I have a whole team of admin staff on the other side of this who will be able to help answer questions as we go along. So we're going to use the Q&A box today for questions. So please feel free to type your questions in there as we go. The team behind the scenes will answer what they can at the time. And then at the end of the webinar, I'll pop in there and answer anything that's left over. There'll also be an opportunity, if you've got further questions that aren't answered today, for you to get in touch with us on the spfund@mentalhealth.org.nz, and we're more than happy to have more conversations with you going forward. We're also going to record this and make it available to all the participants so that you can watch it again or share it with your networks as well. Alrighty, let's have a look. So the All of Population Suicide Fund is part of the Suicide Prevention Action Fund, which is part of Every Life Matters. So a lot of you will already be aware that for the past couple of years, there have been prevention funds for both Māori communities and Pacifica communities. This fund is along the same lines as those and is open to both Māori and Pacifica, but this really does go across every community and every population. So we'll talk a little bit more about the priority groups, but it really is open to any group where we know that they have an increased risk of suicide or mental distress that could result in a higher risk of suicide. Okay, so it's pretty open. It's also pretty open to who can apply, and we'll go over that as well. So the fund comes from Te Whatu Ora, and we will be funding projects between $40,000 and $100,000. So you can fall anywhere within there. Okay, but as you can see from the bullet points here, there is a very strong focus that it is grounded in best practice around suicide prevention and postvention. Okay, so we have to see that link between the priority group and the impact it's going to make for that community. Okay, we'll talk through that a little bit more as we go. So what do we mean by suicide prevention and postvention? Again, Every Life Matters would be a really good document for you to read here, as well as having a look at the Mental Health Foundation suicide prevention resources that we have on our website. But when we're talking about suicide prevention, these are the kind of things we want embedded throughout projects. So a big part is around strengthening protective factors for each of those priority community groups. Okay, and you can go for gold on your creativity and ideas around how we strengthen those protective factors, but we should be seeing that come through in your applications. The other side of that is also we know for our at-risk communities, we also want to reduce those risk factors that can add to that mental distress. Okay, so really ground your projects around those two areas. The other big thing we want to see within this is that we want to see communities coming together and community capability to both prevent and respond to distress grow within that community. Okay, so we'll talk through a little bit further on, but those community connections and talking with your priority population group and having that as part of your application is really important here. Okay. The other side that we're looking at is we know that through our lived experience experts that getting help when they need it and accessing support is a big barrier when it comes to suicide prevention. Okay, so because that is really community based around what your support services are and the access, kind of projects that help improve that access and support when people need them will also be considered as part of this project. Okay, and then we're definitely looking at that really primary prevention focus as well around that early intervention, mentoring, peer support, and how we enable and support those priority groups so they don't get to a point where the mental distress is impacting their life on a day-to-day basis. Okay, so quite a big kind of range of prevention in there that you can fall within. Um, but we definitely want the focus to be around community development and improving their access to services and improving outcomes for people from an early stage going forward. Postvention is also a form of prevention. So we are also looking at projects that support communities when a suicide has occurred to ensure that they have all of the support, they can have those safe conversations. We want to be reducing that risk of suicide contagion within communities and really providing spaces for people to heal and connect and gain the education and information they need going forward. Okay, so right across the prevention spectrum, like we said, it's literally every community and every type of prevention you can come up with. The one thing I do want you to be aware of when you're making your applications is when we look at, and it's a term we've seen come up a little bit more often recently, is that awareness raising with suicide. Okay, we don't really use that terminology around awareness raising. And the reason for that is we know that, particularly if we talk to large groups or go into communities and we are just talking about, for example, suicide risk and mental distress, and then we leave without providing kind of hope and that strength-based story around how people dealt with those thoughts, how they came out the other side of it, and they share that hope with their communities, can be quite dangerous in this field. Okay. And you need to ensure that we're providing that ongoing support. Okay. So if people are triggered by conversations or if they attend, for example, workshops or projects, there needs to be a basis around your application that ensures that they have ongoing support and access to support as required. So our priority populations. Now, I'm very sorry that everyone cannot be named here, but it really is every community. We did want to call the fund every community because I think it summed it up quite nicely. But we're stuck with all the population, so we'll work with it. But we know within our research that there are definitely groups within communities who are more at risk of suicide and mental distress than others. Okay, and we are wanting to improve those inequities across populations. So we will have a weighting towards any population where you can show that they are at higher risk of distress. If for your community that is not necessarily reflected in the national suicide data, that is fine. Even if it's kind of emerging research or lived experience voice coming through in your application, okay, that counts towards that higher risk. So please do include that in your applications if it's not being reflected in this table here. Okay, pretty straightforward in here. You can obviously target more than one of these groups, but you don't have to. So if your project is just aimed at one of these priority groups, that's fine. Okay, again, what we're wanting is the impact for that community. And what I've given you in here is just some kind of ideas around what we know from a suicide prevention base works for what these population groups are experiencing that can add to mental distress. But it's definitely not a tick box. Okay, so if you've got ideas outside those examples I've given, we absolutely want to see those. And that creativity, the basis behind this is that communities know what is best for their own communities. So we really want to see that voice coming through. So who can apply? Again, pretty much anyone at this point. Okay, so it can be an individual, it can be organisation, iwi hapu marae, it can be faith-based groups, schools, tertiary institutions. There is not kind of a group that can't apply. So usually this is quite restrictive in funding, but again, we're really wanting to resource those who are already working in the field, but also those smaller groups or initiatives that can make a real difference within their community. Okay, so pretty much the who can apply is the kind of go for gold part in here. I want you to think of this when you're writing your application form. Okay, so this comes from the Every Life Matters and the Suicide Prevention Action Plan. And you don't have to touch on all of these, but I want you to think where your project would fit in here. Okay, and it can fit in more than one of these bubbles as well. When we are looking in that postvention space, which is our first bubble there, the best practice around that is we're really wanting to improve protective factors. We need to provide spaces for people to have safe and open conversations about their lived experience and what those around them have experienced. And we also need that message of hope. Okay. So it's it's kind of projects where you're combining all of that to reduce risk going forward. Okay. The rest really sits firmly within that primary prevention side. So we're looking at how can we support and resource communities so that the networks are strong. There's good programs and education that is from a primary prevention focus. How are we celebrating the diversity within our populations? How are we ensuring the cultural competence within your project? And we'll talk a little bit more to this. But, it doesn't have to be within a Western Pākehā model. And this is across all cultures, within Asian cultures, Māori Pacifica, what are projects that are from that framework that are going to celebrate, connect, and really move people forward within their own communities? The focus on mental well-being is pretty broad as well. Um, Best practice, again, we're looking at things that aren't just based around conversations around suicide or suicide risk. Okay, we're really looking earlier than that around how we teach people skills, give them the information, and see the impact of those around stress, coping skills, identity, connection, all those things we know build people into a place and support them going forward. A whole bubble just for connecting communities and support services. This is a really strong voice that comes through when we talk to communities about one of the big issues for people accessing services is when I'm not in a great place, I can't just call a phone number, picking up the phone is getting a bit hard at this point. So, how do we ensure that the help is there and the information and support is there within communities to assist people in those times where they need it the most? Okay, and we'd love to see some joint applications between organisations where you're working together to improve your services so that people can move through them and access them easily. Okay, so keep those in mind. When we're weighting the applications, we are going to be checking that they're kind of falling within these types of prevention solutions. Right, the kind of pen and paper bit. So when we look at kind of eligibility and what we must see. So we don't want people deciding what is best for a community without hearing the voice of that community coming through. Okay, so a great example is, are you doing something with youth or within youth justice or with our rainbow community? That needs to be community led. We need to see that it is done in collaboration and that we are hearing that lived experience voice come through. And then the design and the development reaches that kind of best practice standard about what we know is effective. Okay. Time and budget. So the budget can fall, like I said earlier, between the 40,000 and 100,000. It can be anywhere within there. Now, we're not doing applications for anything less than 40,000. Now, that was a decision that we made because we want to see long-term impact and sustainability. So we felt that we needed significant funding going into a project to see that outcome for communities. Okay, so don't make it less because you think you might be more likely to get the funding. We want to see good best practice base that falls between that 40 and 100K. We haven't tagged that funding. So for example, we haven't said, well, we're going to do two 100K, two 40K. Okay, we are going to see the applications that come through, judge them on their merits, and then we will make decisions around how we dispense that 1.5 million, which is what we've got in total. Okay, so a good sum within there. Okay, and we've already talked through that best practice. And again, we're more than happy to talk through that with you. And I've got some links for you on the next couple of slides around some reading that will help you around that best practice side. Any communities that you're working on from a cultural framework also needs to take into account our te tiriti obligations and that there are partnerships within that. Okay, we want to see that leadership from within different cultures. I can't wait to see the different frameworks that people come through with. And again, we want to know what works best for that specific community. And any research you have to back that is great. But if that research doesn't exist, which is the case for many of our priority populations, then share that lived experience voice with us, okay? And share what you're seeing and what you're hearing within that community. Okay. Um, we talk through what I mean by that safe and appropriate approaches for the target population is any discussion around awareness raising. Again, try not to use that terminology. We have to see that there is ongoing support and safety within those conversations. Okay. The judging panel, we have a internal specialist panel at MHF who will do the initial shortlisting. It is possible we are going to try and get a range across our priority populations. Okay, so depending on the number of applications we have for each of those priority populations, if we have some, for example, let's say we don't have many applications in regards to maternal, but we really want to see that is resourced and the application doesn't quite meet what we're looking for, it is possible that we will come back and request more information from you. However, if we have a huge amount of applicants for one group, then we have obviously a waiting system for that shortlisting process. Okay, and those that are weighted against that will come through more highly. The judging panel is a range of expertise. We've ensured that there is both representation and specialist knowledge around those main priority groups. Obviously, in every community group, we can't have that across the board. However, we do have two public health specialists on the judging panel, and we will be drawing from their knowledge as well. Within MHF, we also have our Māori development specialist, Whare. He will be looking particularly at any from a Māori perspective and looking that the frameworks and cultural competency are met in regards to those and giving the judging panel advice. We're also working closely with Te Reo Ora and Levar, who hold the Māori and Pacifica funds, and they will also be helping us ensure that cultural competency across those that are coming through. It's a lot of talking to one slide, isn't it, people? Look at me go. Right, this is important. What is not eligible? So look, this is confusing, and this is the majority of questions I've had come through in the last week. So to make it really clear, we are not going to fund a salary for someone. So I've had a few inquiries like, would you fund a salary for example, a suicide prevention coordinator in our organisation for a year? Okay, we wouldn't fund a salary. However, what I want you to think about is if you had, for example, a suicide prevention coordinator, is what would they be doing? And is there a project that you can develop that is going to make an impact in that community and provide something we can evaluate? We're evaluating the project, not the position, if that makes sense. Okay, so what would that person be doing? What does that project look like? And then you make the application for the project, not the salary. Okay, now when you're doing your budget, you can have 20% is totally capped for administrative overheads. Okay, but in your project, for example, you're probably going to need a project coordinator or project lead. Okay, that's not a salary, that is a part of the project that needs to be funded. Okay, so you'd be providing that within your budget. So that would be additional to those administration and overheads. You might be needing facilitators. You might be needing to train facilitators. There might be other kind of speakers that are coming in or specialist expertise that's coming in. Okay, so don't think position, think project. And what does that project look like? And then work your budget out for the project, not for the position. Okay, and more than happy to talk that through with you as well. Um, if you have already received funding from our Māori and Pacifica suicide prevention funds, whether it's in the past or current, then you cannot apply for this fund as well. Okay. However, if you have already done your project under those and you have a great new initiative that builds on that project, builds on the sustainability, builds on the impact on that community, then we're more than happy to look at those new initiatives as they come through. If you have applied to those funds before and have not been successful, you can still apply to this fund for all of population. Okay, so you can go across the board with that. Study costs and service delivery. Service delivery is kind of that one-on-one work we're talking about. So we're not going to fund, for example, therapy sessions. Okay. However, if you know that a certain therapy can be made into a project, and part of that project is making it more accessible to a wider range of people who may not be able to access it further, then that's a project, if that makes sense, instead of it being funding counselling sessions, for example. Okay. We're not funding existing suicide prevention courses or mental health first aid courses. Te Whatu Ora already has put a lot of funding into life keepers training, and that is viewed as best practice in this area. So if you've got courses outside of that and you're looking to make them more sustainable, that wouldn't be funded. Or an existing mental health first aid course, again, it wouldn't be funded. However, if you've got new courses and development within a particular population group, then absolutely. And yes, you can use that funding to train professionals to deliver that long term within their priority populations. Okay, so, but again, you wouldn't be applying for those professionals to be trained and then deliver. You'd be packaging it as a project for me. And part of that is training your existing staff and upskilling them. And then they would be delivering that, and we would be evaluating the impact that their delivery has on that population. So, Shana, I think that probably answers your question there, hopefully. Again, has to be happening within Aotearoa. Look, one-off events, no, unless there is a big impact for the community. Now, where I can see this happening, for example, might be within our rainbow communities, and the project is actually to build that connection and provide safe spaces and link people in. Okay, so again, your project isn't just the one-off event. The event might be part of a project, and then you are also putting within that application how you are going to engage that community past the event and provide support once you've had that event. Okay, so think big picture kind of community development wise. So what makes a strong application? These are your tick boxes. So just make sure you've kind of got these in as you go through. Okay. So the weighting in the judging panel you'll need to show these things to get the marks towards your priority population. Now, I really want you to focus on those measurable outcomes and impact and long-term sustainability. Okay. What we're looking for is community development projects that have the potential to make not only a short-term impact, and we're realistic around how much impact we can make in 12 months. So we really want to see how that impact is going to continue ongoing. And we're very aware of how difficult it is to get funding at the moment, but think big people around, how would we do this and how are we going to make it sustainable? Okay. Um, Community engagement is vital here. Okay. So I really, really emphasize that you need to be coming together as communities, particularly with those with lived experience within your priority population group. And then you also really need to base it around that best practice around what we know works. Okay. Some helpful readings for you there. The guidance from Te Whatu Ora for this fund is that it has to meet the objectives of Every Life Matters, which are those four bubbles that I put up for you earlier. So really focus your application in there. The Suicide Prevention Action Plan, there's also one 2019 to 2024. This fund came out of that Suicide Prevention Action Plan, the 2025 one. Okay, so definitely worth a read, just to get your head around the language that's used and where the focus is within that action plan. I highly recommend, if you're going to be doing anything within this field, that you hop online and do that free Lifekeeper training, or there may also be ones available within your area. Lavar also has a Pacifica specific Lifekeeper training, so feel free to have a look there as well. And as I said earlier, we've got a number of suicide prevention resources on the website that will be helpful for you to read through, look at the language that's used, and look at the types of conversations and safety within there. There's some great documents there, for example, that if you are having a community event around talking about suicide, how you would do that safely. Okay, so definitely have a look through those documents just so you're aligning your application with them. Nearly there, people. So the process, we have a grant system called Good Grants, and you will make your application through there. Those applications close on the 17th of March. I believe, as I look at my administrator to my left, we have till midnight on the 17th of March. They'll be open till then for you to get those through. Okay, you can start it and go in and change it as you go along. It's not kind of you have to do it all in one go. You can also kind of download the PDF of questions so that you can do a bit of preparation for that. Okay, once we've closed those applications, the specialist team within Mental Health Foundation will do the shortlisting, and then it will be up to the judging panel to make the final decision. So they're going to individually look at anything that comes through from their priority populations and areas of expertise. Two judges will mark each of those to ensure that we don't get any bias within that system. And then they will come together in person to talk through and decide what goes where. And the final decision will be announced on the 4th of May. So not far away. I might be rocking in a corner by then, but that's okay because I have a great support team. Once we've announced it, we will be getting in touch with obviously the successful applicants and starting that contracting process with you. And what we'll be doing there is looking at your project plans, finalising those, finalising the deliverables, getting the contracts signed, making sure you're all okay with the reporting, those sorts of things. And on the 20th of May, we have funding to ensure that we bring all of the successful applicants for a hui up in Auckland, where we'll all meet together to hear about each other's projects, share some information, and we'll be talking through some more kind of best practice and the evaluation process. We've also put within the fund specialist mentors within suicide prevention. So each of the successful projects will also have a mentor to work alongside them to ensure that we, you know, that you have someone to go to, because this can be a very difficult and triggering space to work in. But you've got that specialist knowledge alongside you when challenges come up within your project to help you work through that. By the end of May, we should have all contracts signed and the first payments made through. The payments are based on deliverables, so we'll work that out with each individual project depending on what is entailed. And then your project winds up by the end of May, and which gives me a month to do the reporting back to Te Whatu Ora. And then fingers crossed, we have another round, all going well. So pretty straightforward. Again, we're here to answer any of your questions. And if you look in the chat, we've got that SPF fund at mental health email address. Just flick them through there and we'll do our best to answer quickly for you. And that is us, people. So feel free to pop anything in there that you need to, and I will answer some of these live. Cool. Thanks, Matakuri. Yep, so we have the capability, if they are written in Te Reo Māori, to be able to get those assessed within our judging panel and from our specialist team. Okay, so anything that's coming through from a cultural perspective will go to specific judges who are specialists in that area. We're also working with Te Reo Ora and Lava, so those teams will also help us as those applications come through. Um, Around the cultural competency guidelines, look, we haven't gone into a lot of in-depth in there because it's in every community. But what we want to make sure is that in every project that comes through, that we see their cultural competence within that framework, but also that it aligns with our Tiriti obligations as Tiriti partners. Okay, so anything you can put into your applications grounded, and that is going to be very beneficial to your application. So please feel free to add that in as you go. Matakiri, I'm more than happy also if you want to discuss that further, flick us through an email to SP Fund at Mental Health, and I can link you in with Whare, who is our specialist overseeing that side of the project, and he'll be more than happy to talk that through with you further as well. Cool. Uh, yeah, look, we're lucky within our team. So does MHF, I see someone's typing, choose the mentors. Look, we are at this point, but if you know some really great people within your priority population who you think would be great mentors, please flick them through to us. We do have money within there, obviously, to pay those mentors. So yeah, if you've got any ideas, more than happy to hear what some great mentors, or if you're on here thinking, I'd be a great mentor, come on through, introduce yourself. And yeah, if you know within your community, there is a specialist within your community, and that is going to be the best mentor for your community, then I'm more than open to having those conversations with you. Okay, so just pop them through. Perfect. Previously funded projects. Cara, thank you for that. Look, go on to Toro Ora and Lavar's website around the suicide prevention, and they have some great kind of storytelling resources there from previously funded projects. We don't have any previously funded projects for the all of population because this is the first round ever. But yes, I can, if it's not a salary, I understand that the capacity gets very hard. What I would suggest you do, particularly if you're working in that space, is look to those community organizations around you, and the partnership between the two might provide the capability to then carry out a project that you couldn't otherwise do alone. Um, so have a look at that. You can, for example, bring in a project lead or project coordinator. So that could be a new person that's coming in. What I'm not going to look at, what I'm not going to look at, what we're not going to look at is if you made an application saying, can you pay for a salary within our team for a year? Okay, but if you say, I've got a project that I want to do around maternal mental health, we don't have the capacity within current staff, we're going to need a project coordinator, we're going to need a facilitator, then you can add those into the budget and they can be new positions for the life of the project. Cool. Valerie, yes, private companies can apply. Most of the funding. So we won't. So I think someone's answering you there, Jessica. So again, your application can't just be for service delivery. Okay. So one-on-one calls with people, I want to see a project around that that I can measure the impact on a community of people, not just one-on-one service delivery. Okay, so you might have to be a little bit creative around how you package that up. Mm. So can we apply for current projects that have been running for 15 years? Depends a little bit on that one. So what we would want to see to that is how are you growing that project and how are you making it sustainable long term? Okay, so we don't want to just fund you for another year to keep it going for another year. But if as part of that facilitated peer support group, there is a project within there that is going to grow that project, provide a bigger impact to those women who are involved, and is going to improve the sustainability long term, then absolutely. But package it for me in that way. I need to see more than just this has been working for 15 years and we need another year's funding. If that makes sense. Yeah. Yes, 20% of the overheads can go towards salaries. So yeah, administrators. So you've got a current administrator, for example, who you're going to use as part of your project, then that can definitely be in the 20% overheads. You can also put project lead kind of contract positions for that project outside of those overheads. Yes, Jackie, if you think you'd like to be a mentor, just we haven't got an application form yet. It's really going to depend on the projects that come through as well. But Jackie, drop us a line. I'd love to have a chat and meet you. Right, what haven't I answered here? I think I've done that one. You've been funded by Toro Order, just to clarify. Yep, perfect, Kelly. You can apply again. So again, we see making those projects and growing those projects that have already been sustainable as a great initiative, right? Because you've had a successful project and now you need to keep growing it to make it sustainable long term. So absolutely, you can grow on that project. Cool, I've done all those. Have I missed any, team? I think we're done. Any final questions coming through there? Awesome, team. Again, thanks for joining us. And look, any questions, just flick through an email to us and you'll get to Vicky and I, and we're more than happy to answer as you start going through that application form. But I can't wait to see all the amazing creative community development based projects that come through. All the best, team. Haere rā.